So I think it's important to start noting that all drugs are illegal in South Africa, and as a result that influences whether or not people are at risk for HIV or viral hepatitis, because both of those infections can be transmitted through blood, also through sexual contact. So in South Africa, most people who inject drugs contract it through the use of contaminated injecting equipment. So either they don't have access to new needles and syringes and have to use other people's equipment, and sometimes through unprotected sex. And there have been some policies in place that highlight that these people who use drugs are at increased risk for HIV and viral hepatitis, but there's been very little explicit policy support for interventions that are proven to effectively prevent or manage these infections. Specifically, the National Drug Master Plan, the previous one, did not give explicit support for needle syringe services or opioid substitution therapy, and gave very little information around injecting drug use in South Africa. But the reduction of viral hepatitis and HIV is included in the National Strategic Plan for HIV, TB, and STIs. And within that policy, people who inject drugs are defined as a key population. So there are some policies that support the prevention, treatment, and management of these conditions. And also, in our context, service delivery for people who use drugs around viral hepatitis and HIV have started. They're limited at the moment to our major metropolitan areas, so Johannesburg, Pretoria, Cape Town, Port Elizabeth, and Durban. However, they've started with needle syringe services, and opioid substitution therapy is starting to become more available, but in most cases it's just a small number of people as demonstration projects. And all of those, apart from the city of Tshwane, are funded by global donors, so principally the Global Fund, and in Pretoria also by PEPFAR. So I can only talk about the information that we've been involved in. The other information is still in the process of getting ADS clearance. So I'm going to stick my discussion to the Key Population Hepatitis Initiative, which is implemented by the TB HIV Care, Anova Health Institute, Out Wellbeing, in partnership with the University of Cape Town and the National Institute of Communicable Diseases. And that was a larger study among key populations looking at viral hepatitis and HIV. And it was done as part of service delivery. So it was people who were already accessing services, and included viral hepatitis screening for B and C and confirmation of testing. So what we found in that study among people who inject drugs is that there was a range of viral hepatitis prevalence. So that's the number of people that are living with infection. It was significant. So in Durban, it was about 29%, in Cape Town, 34%, and in Pretoria, 73%. And those were all people who we had virological confirmation of the infection. So all of those people needed treatment. And in terms of HIV, it was much lower than that. In Cape Town, it was just under 10%. In Durban, about 20%, and similar amount in Pretoria. And we haven't yet analyzed all the data associated with that, but that's the prevalence. So those are the number of people who are living with those infections, and all of them would need some kind of treatment. So as part of the monitoring of South Africa's response for HIV, we want to be able to assess how we're doing in terms of reaching the targets that the United Nations Joint Program on HIV and AIDS is set, and that's called UNAIDS 90-90-90 treatment targets. And ideally, we want 90% of people who are living with HIV to know their status, 90% of those to be on treatment, and of those on antiretroviral therapy, 90% of them to be what we call virologically suppressed. And if people are virologically suppressed, they will do much better. They will live a very long, healthy life. And there's zero possibility of them actually transmitting the infection to other people. And what we do is look at that for the general population, but also for specific populations. And as the programs for key populations and people who use drugs is increasing, we'll be able to develop cascades from our programmatic data. But also recently, there have been some cascades work at looking at surveillance data. But that surveillance information only comes from the 2 sites where integrated biobehavioral surveys have been done. And that was in Cape Town and in Cape Town and Pretoria. And what that shows is that a large number of people know their HIV status, but less than half of them actually start antiretroviral therapy. And we actually have no data on, of those people, what the viral suppression is. With viral hepatitis C, we would also like a similar cascade, so to know what proportion of people know their status, what proportion are on treatment, and those people that start treatment, what proportion get cured. At the moment, we don't have any of that data, and there are actually no services targeting people who inject drugs to put them onto treatment for viral hepatitis. There are, in the public sector, a few academic hospitals who make use of a Section 21 to access direct-acting antivirals, which are the medications used to cure viral hepatitis C. But because the medications, principally sofosbuvir, is not registered yet in South Africa, it's only available through importation and in a limited number of cases, and it's still very expensive. So in our experience, very few of the people who we found living with viral hepatitis we could successfully link to care for a range of reasons, partly because of where we reached them was very far from where the hospital was. People had had very negative health care experiences generally. Some people didn't have hope or feel that there was much use in them getting treatment because they didn't feel that there was much in their future for them. So what we now would recommend is trying to find ways to provide those services in the community. And that's really our next step, so we can get a better sense of how to improve our response for viral hepatitis.